Here's your breast surgery 101 class. There are many different ways to have surgery after you were diagnosed with breast cancer. I was diagnosed with stage 2 breast cancer 3 months ago. I underwent a lumpectomy. I was also the primary caretaker for one of my sisters when she went through breast surgery, had a double mastectomy and a tug flap reconstruction. My other sister also went through a double mastectomy with implant reconstruction. A lumpectomy is where they remove just the breast tumors in your breast with a little bit of extra tissue around it to make sure they get all of the cancer. Lumpectomy is a breast conservation technique. We have a unilateral or single-side mastectomy where you remove all the breast tissue for the breast that has the tumors in it. You can also have a double mastectomy in which they remove both breasts, whether or not both breasts have tumors or not. Some people choose to have both breasts removed, even if only one breast is affected. Many factors can play into this decision, including if you have BRCA1 or 2 or any other genetic mutation that might increase your risk of recurrence. Whether you have a mastectomy or a lumpectomy, you may be looking at reconstruction. Reconstruction is generally with a breast plastic surgeon who makes it look pretty afterwards, basically. If you've had a lumpectomy and things don't look quite right, you also have a small reconstruction to make everything look more uniform between two breasts. If you had a one-sided mastectomy, you may choose to put an implant in there. You may choose to have a reconstruction with your own tissue. There's saline and there's silicone implants. And there's flap surgery. Flap surgery is where they take parts of your own body, take that tissue and reshape it and make it into a breast. The most common one is the deep flap, where they take your stomach tissue. My sister had a dug flap, which is diagonal portion of her inner thighs were used. There's also a flat closure that you can choose, which you do not want any sort of implant. You may not want any more surgery after you have your breast removed, and they'll do a simple flat front closure. Lots of options, so I would recommend talking to at least 2 to 3 different breast surgeons to get their opinions and decide what you want to do and decide if their technique and approach would be best for you. You need a wedge pillow for sleeping. No matter what kind of breast surgery you've had, you won't be able to use your arms to lift yourself out of bed, especially if you've had a mastectomy. Try to get in and out of bed without using your arms, and you're going to find it's very difficult. A wedge pillow will make you comfortable at night because you're going to be very uncomfortable. It'll help you also to get in and out of bed when you're not starting from a flat position. After any sort of breast surgery, you may have drains coming out of your body, and that's to make sure that you don't retain a lot of fluid as you're healing. You can leave with a soft recovery bra, which is a zipper or a Velcro closure in the front. Sometimes your recovery bra will have little loops to manage your drains. If they don't, you can stitch on little loops, get a lanyard, wear a hoodie or something with a pocket where you can put them in. Really, this is going to be so challenging, and it's okay to grieve this process. Don't worry so much about the scar care because there are lots of different products that you can use to minimize scarring, such as silicone tapes. This is also another reason why you want to have second and third opinions with breast surgeons. Some breast surgeons have a finer hand than the other. Some of them have microsurgery technique. Ask your surgeon what their technique is so you can evaluate how big your scars are, because that is part of the process. CT can also help you with any scar tissue, internal or external, then you should definitely consider that as part of your healing process. Let me know in the comments if you have any questions. I'm happy to answer, and follow along for more tips.